Hi, I'm Dr. Manish Garg, consultant cardiac surgeon practicing in the city of Mumbai. Today we are going to speak about healthy diet for a healthy heart. On this occasion of World Heart Day, we will learn about the role of a diet in strengthening the health of the heart. Heart diseases are one of the most common lifestyle diseases. Some of the most prominent factors for increased incidence of heart disease includes sedentary lifestyles, stress, excessive salt intake, junk food, smoking, and excessive intake of alcohol. Nowadays, numbers of safe and effective medicines are available to treat heart diseases. While weight control and regular exercises are critical to keep your heart going, the food that you eat matters just as much. No single food intake can make you magically healthy. So, your overall dietary pattern is more important than a specific food. So, what all you should intake to make your heart healthy? Number one is eating more fiber, more fruits, and vegetables. Why so? Because vegetables and fruits are good sources of vitamins and minerals. They are also low in calories and rich in dietary fiber. Vegetables and fruits, like other plants and plant based foods, contain substances that help prevent heart diseases. Eating more fruits and vegetables may help you cut back on your high calorie foods such as meat, cheese, and snack foods. What else can you do to prevent your heart diseases? You can have whole grain food. Whole grains are good sources of fiber and and play a significant role in regulating the blood pressure and making your heart healthy. You can increase the amount of whole grains in the diet or make simple substitutions for refined grain products. You can also be more adventurous and try new whole grains such as brown rice or barley. The third important thing about making your heart healthy is to reduce your salt intake. Eating too much of salt can lead to increase in blood pressure, which in turn will affect the health of your heart. The research recommends that a healthy adult should have not more than 1.5 grams of salt in a day. In fact, the less sodium you eat, the better blood pressure control you will have. So, reducing the amount of salt you add to the food at the table or while cooking can be a good first step. In fact, much of the salt you eat comes from the canned foods and processed foods. So, avoid them. Use spices for flavor. Try fresh herbs like basil, thyme, chives, or coriander. Substitute with reduced sodium versions or salt substitutes. Choose your condiments and package foods carefully, looking for foods labeled as sodium free, low sodium, or unsalted. Or better still, use fresh ingredients and cook without salt. That will be awesome. Fourth thing is to reduce the amount of a fat intake. Not every fat is bad, but definitely cut on artificial trans fats. It raises your LDL or the bad cholesterol and increases the risk of your heart attack and stroke. Artificial trans fats also lowers the HDL or the good cholesterol, which can put you at increased risk of heart diseases. It's worth checking the labels and avoiding anything that is partially hydrogenated oils in the ingredients, even if it claims to be trans fat free. Not only about the artificial trans fats, but also limit the intake of saturated fats. Saturated fats constitutes tropical oils, dairy like ghee, red meat should be limited to not more than 10% of your total caloric intake. Enjoy dairy in moderation and vary the protein sources in your diet, opting for fish, skinless chicken, eggs, and vegetarian of sources of protein where you can. Eat more of healthy fats. So, what are these healthy fats? Eating foods which are rich in monounsaturated and polyunsaturated fats can improve your blood cholesterol levels and reduce the risk of heart diseases. Eating omega 3 fatty acids every day, that is, fatty fish such as salmon or from flaxseed, kale, spinach, or walnuts. Other sources which provide these good unsaturated fatty acids are avocados, nuts, and nut butters. Lastly, don't replace your fat with sugars or refined carbs. Our body does not need any added sugar as it gets all the sugar it needs naturally from the food that we eat. Sugary foods and refined carbs just add up to the empty calories that are as bad to your heart as to your waistline. Instead of sugary soft drinks, breads, pastas, and processed foods like pizzas, opt for unrefined whole grains like wheat or multigrain bread, brown rice, barley, bran cereal, oatmeal, and non starchy vegetables. To conclude, I would say diet plays a very crucial role, not only in developing but also in controlling the progression of heart diseases. I advise to all my patients to adopt a healthy lifestyle which plays an important role in not only treating heart complications but also in preventing it. Thank you.